The intricate dynamics of air quality and its profound impact on human health is a crucial but sometimes overlooked metric while examining the increasing health crisis in current times. Clean air is not a luxury but a basic human right which is not affordable to us in our modern world, where the essence of our life is under constant threat by humanity's most sinister adversary, pollution. But how does a lack of air quality disrupt the intricate workings of our human body?
In normal conditions, they do not have any lung-related problem. But when pollution levels rise, then the particulate matter, particularly of the size 2.5 micron and smaller, they start concentrating in the respiratory system in larger quantities. As a result, they set in new diseases in the body. That means people who did not have COPD now will start developing signs and symptoms of COPD. Or people who might not have had asthma in the past, because of the composition of the PM 2.5, they may develop bronchial asthma now. Now, their diseases are not going to be as severe, that will gradually develop. So that way, the effects are twofold. One is acute exacerbation of existing diseases, and the other is normal healthy adults now shifting towards becoming sick because of exposure to the pollution. Air that we are supposed to breathe normally, naturally, should contain oxygen, nitrogen, carbon dioxide, and a mix of few other gases and nothing else. So anything else that gets into the air is a foreign body for the human being. Human being will respond at the mechanical level as well as immunological level. Whenever a particle, any solid particle, strikes a mucous membrane, either in the respiratory system or in the eyes or in our oral cavity or the gastrointestinal system, it will cause inflammatory changes. And those inflammatory changes will manifest into diseases. So no system will remain free of effect of the pollutant particle if it has a mucous membrane. That is the basic premise of causation of disease due to pollution. Secondly, the smaller particles, the nanoparticles, which are 1 micron or less, they have a tendency to cross the mucous membrane of the lungs and enter into the blood. Now, once they enter into the blood, they can get deposited in any body, any part of the body. They may get into the brain, they may get into the heart, they may get into the liver, kidney, or pancreas. Now we are finding association that diabetes risk is increasing among those who are exposed to pollution. Hypertension or acute cardiovascular events are also increasing because the simple reason that the nanoparticles can cross the mucous membrane blood barrier enter into the circulation system and affect any organ. So practically no part of the body remains free of the effect of pollution.
The average Indian life expectancy is shortened by 5 years with current air quality levels. In India, a whopping 60% death is caused by COPD, a chronic inflammatory lung disease, along with 43% lower respiratory infection, 32% lung cancer, 24% diabetes, 32% heart disease, 39% stroke, and 21% neonatal deaths, all attributed to air pollution. A 2019 study of the number of total global deaths attributed 6.67 million deaths around the world to air pollution alone. Of these, a staggering 25% of the fatalities occurred in India, encompassing both air pollution related and other causes. The entire Indian population of 1.4 billion people live in areas with pollution that is more than 10 times higher than the WHO guidelines of 5 micrograms per cubic meter of air, making our country one of the most polluted countries in the world. But pollution is a very sinister threat to people's lives. It is never the direct cause of the loss of life, but rather the first domino of the deterioration of good health.
In a real sense, you cannot say, because a person never dies of air pollution, the person dies of a disease. Now that disease could be stroke, the disease could be lung cancer, the disease could be some other thing. Now that disease outcome can be triggered by air pollution, it can be triggered by lifestyle, it can be triggered, and the data is there. If GBD numbers are not believed, I would then argue that let us do the study. Even if you don't believe the mortality numbers, look at the other health outcomes. More than 50 studies are till date available, showing this impact. And that impact is very clear, not just for respiratory, for almost all types of disease outcomes.
When you think of managing air quality, health is an often overlooked area.
We need to do more in terms of integrating the health issues in the air quality management issues, because so far the focus is on source reduction. But the citizen participation is relatively less because there is a lack of awareness of understanding the intricacies of relationship between air pollution and health. People superficially understand that, okay, if there is more pollution, there is likely to be more health issues. We are not living in airtight compartments in our homes, right? So whatever is the outdoor air pollution, it will affect the composition of the air inside the house also, because there are windows, there are doors, and everybody cannot afford, or you cannot install air purifiers in every living room. Then secondly, people for the purpose of fitness are advised to go do outdoor activities, whether it is walking, jogging or cycling. It becomes some kind of a juggling that protect yourself from the ill effects of pollution or protect yourself from the ill effects of a sedentary lifestyle without any physical activity. These dilemmas are not addressed properly in our air quality narrative that we are building and trying to propagate. Therefore, more engagement with the citizens in different groups. Engagement is very important to apprise the citizens about the true relationship between pollution and health and what are the doables at the micro level. That means how individuals can participate in protecting their health and at the same time reducing the sources of pollutant in the country. It has to be built into the lifestyle of the people, that how they should be behaving in different scenarios, how to protect their health even if they are in the even when they are in the quiescent period, that means when the pollution levels are low, so that the adverse effects are also relatively less even when they are exposed to the higher pollution, in terms of healthy lifestyle, better diet, building better immunity.
When you actually do a population scale analysis of the health impact, exposure is just one factor. How much people are exposed, what is their age, what are the other risk factors, socio-demographic conditions, they are all important. And we have done some studies where it is very clear that even if you reduce exposure level and meet the NCAP target, you will not get major health benefit in most of the states because your population itself is increasing and population is aging. So it means that you need to even reduce the pollution level further to get considerable health benefit. How do you take this whole message? Two different target audience. One is the policymaker, also to the community. There is so much science. We need sort of a compendium and a policy brief to tell the policymakers that this is the framework, please follow this. You need a different strategy when you talk to the community or general public. There, I think the medical or health sector must play a bigger role, because ultimately, if the message comes from a doctor, people listens to them, people follows them. When a patient goes to a general physician, for any health checkup or any, then simple questions are asked like, where do you live, whether do you smoke. Why don't we add very basic information to get a sense about the air pollution exposure? For example, it could be asked like whether your house is close to a major road, or do you have any immediate air pollution sources in your neighborhood. All it needs actually for the doctor is to tell the patient that air pollution is also a risk factor. Most people are not aware that air pollution is also a risk factor for many of these NCDs. So they are actually, those public health workers, professionals need to be also educated.
Access to clean air is a fundamental right for every citizen. It calls for collaborative efforts from agencies, communities, and individuals to collectively address environmental challenges, fostering a livable nation and shedding the label of being amongst the most polluted.